Hello, everyone. I'm Dr. Marty Ross, and tonight is another Conversations with Marty Ross MD's webinar where we're going to discuss Lyme disease. I look forward to seeing what questions you have in store for me tonight because that sets the theme of the evening. And so, as many of you do know, it's your questions that create these webinars. So I don't have any kind of canned discussion tonight, although as many of you know that are back here again, I can talk about a lot of things. So I use your questions as a means of doing that. For those of you that are new here, there's a couple ways to participate. One is to write questions to me. And the way you can do that is on the bottom side of the screen, on the right-hand side of the screen, there is a chat box that you can use and you can write your question to me there. The only thing I ask is as you write that question is do not hit your enter key to create paragraphs. Every time you hit the enter key, it sends a separate question to me. So I ask that you only hit the enter key when you're completely done writing that question. So just write it as one big long run on, okay? So one way to participate is write a question and see what kind of response I give. Second way to participate is to listen to the questions as I read them and see what kind of responses I give. I use your questions as a platform to discuss things, to kind of explain things and to give round out your understanding and hopefully give you some ideas that might help your care as well too. Be aware I can never get through, well, never is kind of a big word, but I often do not get through all of the questions. There's more questions than usually I'm able to handle in an evening, but we'll do our best. I always try to do my best to get through these, okay? I am creating a recording of tonight's webinar, and tomorrow morning somewhere, usually before 9 to 9:30 a.m. Seattle time, Pacific Standard Time, I do send out an email to you announcing that that's ready, and it includes a synopsis summary of the kind of things that we talked about as well too. All right, so keep your eyes out for that. Within that email will also be a link to sign up for next week's webinar. Now, next week, for all of you that know, I often do Thursday webinars, but every now and then I'll do a Wednesday. So next week, it's going to work out better for my personal schedule to do a Wednesday webinar rather than a Thursday webinar. So it'll be a Wednesday webinar. If you had previously signed up for next week's Thursday webinar, you will need to re-sign up again. Once I change that schedule, it gets rid of anyone that might have signed up for the webinar, okay? So re-sign up again, basically, okay? And yeah, I think that's most of the information I need to talk about. Oh, one last thing. For those of you that are participating live, you'll get to see the questions on your screen as I read them. They do not show up in the recorded version, no, okay? All right, so let's go ahead and get started here. Hello, David. Let's see. Hello, Dr. Ross. Can low dose 1 milligram naltrexone reduce inflammation? And what do you recommend to lower severe inflammation? Lastly, can low dose naltrexone damage your liver? And can you have an occasional glass of wine alcohol while taking it? Thank you for these amazing webinars. You're welcome, by the way. So everyone, when you have chronic Lyme disease, the inflammation that people have is a result of the immune system overproducing a group of chemicals called cytokines, okay? And there's a variety of cytokines. So things like interleukin 10, interleukin 4, TGF-beta1, VEGF. These are all cytokine names that you might have run into somewhere, okay? So the foundation of what we want to try to do is to get rid of your germs so you're not inflamed, okay? So if you have tick-borne illnesses, kill them. Use your antimicrobials to get rid of them. Either it's herbal or prescription. All right. So that's one thing. If you have mold toxin illness, that will also trigger body-wide inflammation. So you need things to treat mold toxin illness as well too. All right. So the foundation of getting inflammation down is getting at the underlying cause of that inflammation. It could even be yeast overgrowth in your intestines. All right. Then the next thing to do is to take supplements that can help reduce cytokine production. And one of the best ones to do that is curcumin. Curcumin is a component of the Indian seasoning turmeric, and it works through a variety of ways to decrease cells' production of a large number of cytokines, okay? And so that's 500 milligrams 3 times a day. In extreme cases, I'll have people take 1,000 milligrams 3 times a day. Okay. The product I like for that is a liposomal product, meaning it's microscopically wrapped in fat. And that's a product by Thorne called Mariva 500 SF. Okay. The other thing I like to combine with that, and with the people that are having a lot of inflammation, is to do glutathione. Glutathione is an antioxidant that's made in every one of our cells. It helps repair damage to cells. It's also used to detox by the liver. And as an antioxidant, it decreases oxidation agents that tell your white blood cells to make cytokines. So think of the curcumin as getting into the factory, the white blood cell factory, and blocking the production line. And then think of glutathione as blocking the order to make cytokines from even getting to the white blood cells. Okay. And so the dose, what a product I like using for that, I like a liposomal product for that too. Liposomal means it is microscopically wrapped in fat to increase absorption. The product I like for that is a product by Researched Nutritionals called Trifortify. There are 2 flavors. I like people to take 1 teaspoon at least 1 time a day. Severe inflammation, 1 teaspoon twice a day. Okay, so that's just the fundamentals. Get at the underlying cause, take some curcumin, take some glutathione. Okay, all right. Now, if that's not doing well enough, then you can look at something like low-dose naltrexone. And what naltrexone is, everyone, is many of you may be aware of it. It's something we use to block narcotics, actually. We use it for people that have drug overdoses. But it also can regulate our immune system and try to turn down that inflammation that's happening. And specifically what happens is we have a natural narcotic system in our body called endorphins, okay? And the endorphins that we produce regulate pain, but they also regulate the immune system. And so what happens if you use naltrexone at a very low dose, it's manufactured as a 50 milligram pill, but when we use low dose, it's anywhere usually from 1.5 to 4.5. I know you mentioned 1 milligram here, and that's a reasonable dose to try too. But we use low dose, and what happens is we give it to you, and your endorphin receptors get blocked. And there's 2 things that happen as an outgrowth of that. Number 1, your brain doesn't like it. It doesn't like that these endorphin receptors are blocked, and it sends out a bunch of signals to the endorphin-producing cells in the body to make more endorphins. So they do. All right, so you've got excess endorphins floating around now, okay? And then the other thing that happens is the receptors that are blocked don't like it either, and they start becoming super sensitive to any endorphins that are still out there. So the effect is then at about 4 to 6 hours, when your endorphin receptors get unblocked as the low-dose naltrexone wears away, what happens is they get flooded with all these excess endorphins, and those endorphins stick to them better because they're super sensitized, okay? Now, in your immune system, what can happen is this can result in increased levels of something called a T regulatory cell. And the T regulatory cells are basically try to influence the cytokines made by your Th1 germ killers and your Th2 immune system defenders. And your defenders would be things like your mast cells and your white blood cells that make antibodies, and cells that line your mucous membranes that attack germs, okay? It tries to create harmony between these 2 sides and balance their cytokines out, all right? So yes, it can be a regulator. Now, if you use it, I tell people it can take anywhere from 1 to 6 months to see benefits. So it used to only advise people to take it for 3 months, but I went to a workshop and discovered most of my colleagues were seeing benefits more at 4 to 6 months. So I usually stay with people for 6 months at least before we say it's not going to help. Does it have any effect on the liver? No. This is something that you can use. It's not going to inflame your liver. You can have some occasional alcohol. It's not going to create a problem there at all. In terms of the dose, we try to usually go 1.5 to 4.5 milligrams. So a typical starting dose would be 1.5 milligrams daily for 2 weeks. Then you go up to 3 milligrams daily for 2 weeks, and you go up to 4.5, okay? However, not everyone can tolerate the 1.5. And so I've had people, if I try 1.5 and somebody is having side effects, usually it can be some like cloudiness of your head or maybe some nausea that you get from it. If I have a person that's having intolerance to a 1.5 milligram dose, I might go down to 0.5 milligrams, or I might try 1 milligram. And in any of those situations, those doses can work for a person. I've seen benefits from that as well too, okay? I think I have. I'm just looking back to your question. Yeah, I think I have answered your question. All right. So that was a long-winded response. As you know, I can get long-winded, but I just wanted to understand, everyone to understand that there's many levels to managing your cytokines, okay, or your inflammation. All right. Good luck to you, David. Hello, Jim. Hi, Dr. Ross. Thanks for these great webinars. You're welcome. Like you, I'm a 60-year-old guy. Yeah. Yeah, how did I get here? And I'm sure you're wondering that too. But yeah, 60-year-old. I'm a 60-year-old guy looking to make the most of my remaining years. What are some of the key things you are focusing on to remain healthy from now to 100 or so? Also, do you ever use the GI map test? If so, are there any things you find it particularly useful for? All right. So I'll answer the aging stuff first, and then we'll talk about the GI map. So, the things that basically, if we look at data from something called the blue zones, there's a book out there called The Blue Zones, and if you were to read it, what it's about is there are, I think, about 6 different cities where people live forever. They into their upper 90s and their hundreds, okay? And they tried to break the code to figure out, well, what's unique about these places? And so one of them is Loma Linda, California, for instance. Another one is a Japanese town. There's a Greek town in there. There's 6 different ones, okay? But the components that they found are the following, and these are things I try to incorporate into my life, okay? Number one, regular exercise. Do physical activity. If you're a farmer, that's your physical activity. But if you're not, you're sedentary, then make sure you're doing regular physical exercise of some kind, okay? Number 2, have active social networks. People that tend to have, the elderly that are well-connected, visit with their family and friends, tend to live longer than ones that don't, okay? All right. Number 3, they call it wine at 5, red wine at 5. And it's not even just red wine, it's one drink. Now, I'm not advocating alcoholism here, but for some reason, these communities where people have one drink a night, it may be that one drink is how they socialize with their friends, so they're getting socialization. But that one drink a night is something that can be beneficial. Probably red wine would be the best because of chemicals in it, but that's another thing too. Let's see, number 4, I suggest, and I think the predominant thing is the type of diet that people are having in the blue zones tends to be more of an anti-inflammatory Mediterranean style diet. So that means low on red meats, because red meat fat tends to be inflammatory unless you're getting grass-fed red meat. So grass-fed beef or grass-fed bison would be fine, but grain-fed red meat of any kind is inflammatory. So in these societies, they use more of a Mediterranean diet, which is rich in seafood, but also rich in plant-based diets, okay? All right. So the big things are about the ways to extend your life are, number 1, have good social networks. Number 2, eat some type of a healthy, more predominantly plant-based, low-inflammatory diet. Get rid of the red meats as much as you can. Number 3, exercise. And number 4, they call it have wine at 5 o'clock. All right. So probably, again, some of that benefit is from people sitting around and socializing. Okay. All right. Now, are there anything else that I'm doing to extend my years? No, that's pretty much it. Now, there are some, if we start looking at the anti-aging communities or anti-aging doctors, sometimes one of the things that you can do is to try to optimize and increase your levels of testosterone in a male or your estrogen progesterone in a female, and having higher levels than your body normally would make at our ages will help extend your quality of life. So makes it so that as you hit your 60s and 70s, your ability to function stays up here, But then at around your normal age that you die, everything declines rapidly, basically. Versus if you're not on hormones at an optimal level, you'll just have a slow decline. Okay, so you could do that. I don't do that, but there's some people that wind up doing that as well too. And then finally, there's one thing I'm looking at, and I haven't gotten into it enough yet, but there's your DNA has ends on it that are called telomeres. And as we age, our telomeres get shortened. And that corresponds with nearing our end, basically, okay? But you can there's supplements you can take that actually block the shortening of the telomeres. And that's used an enzyme called a telomerase. And so some people take those, and I'm looking at possibly having a product that would do that at my supplement store. I haven't been doing it yet, but there's some data out there that suggests that might be beneficial as well too. Okay, all right. So, but I don't do the hormones, and I'm not doing the telomerase at this point. Okay, all right. So, in terms of GI maps, so the GI map is a way of studying their gut microbiome. In other words, what organisms are there? All right. Are there some in excess? Are there some low? The other thing you can get on a GI map is there's markers on there like elastase that tells us whether your pancreas is making enzymes correctly. There is a chemical on there called a beta-glucuronidase that can tell us if it's high, that indicates you've got dysfunctional bacteria in your gut or dysbiosis, okay? There is a chemical you can add on to it called zonulin. If zonulin is increased, it can indicate that you might have leaky gut syndrome, which means you've got gaps in between the cells that line your intestines, and things are getting through to your bloodstream and your immune system that might inflame you. Okay, all right. So yeah, I use it periodically. I'm using it usually more in people that have a lot of gastric dysfunction or intestinal dysfunction, and I'm trying to see, is there something I can learn about pancreas function and whether they have an imbalance in good bacteria in there or not. And sometimes I'll look and do the zonulin level just to see, is there this thing called leaky gut syndrome as well too. Okay, all right. Thanks for that question, Jim. Good luck to you at 60 years old. That's where I am as well. All right. Hello, Sai. Let's see. A while back, you spoke about a special kind of licorice for gut issues, ulcers, gastritis, heartburn. Can you please say again what kind of licorice it is and where is the best place to get it? How exactly does it work to soothe the gut? Will it work for someone whose gut issues flare up really bad after taking Tylenol for COVID? Yeah, okay, so licorice, it's a type of, and I'll show you a product that has it in it too. It's a type of licorice called decalizerated licorice. Basically, there's a chemical group called the glycyrrhiza group that is removed from licorice. And the reason it's removed is glycyrrhiza can lead to increased blood pressure, okay? And you chew these 2 tablets, and what happens when you chew the tablets, your saliva interacts with chemicals in the licorice, which then creates a microscopic gelatinous coat of both your food pipe and your stomach, right? What it's really good for is people that have gastritis, which means inflammation of your stomach lining. I'm not sure from your symptoms whether you have inflammation of the stomach lining or not. I might be able to determine that if I get to ask you more questions, but the other thing is just try it. See if it makes a difference for you as well too, okay? Generally, I'll have people take a product called Rhizonate that has the licorice in it, and you chew a couple pills before meals 3 times a day and even before bedtime too, okay? Let's see. All right, let me show you. So you can get it from me if you want to. So let me just do a quick screen share here. All right, so this is my supplement store. It's Marty Ross MD supplements. And in terms of the licorice product that I have, you can just type in here licorice. All right, So you're going to see these two products. One's called Rhizonate, fructose-free, and one with Rhizonate. This Heligard that's showing up here, I actually need to get rid of it. It's no longer made by Researched Nutritionals, but you could choose either one of these. Again, I ship to the US and to Canada, so feel free to do this if you want to. And this is the Decalizerated Licorice. Okay? All right. This is how you spell decalizerated. It's actually quite a long, I always have to look it up. I can never quite get it right, actually. All right. All right. Thanks for our question, Simon. And good luck to you. Hello, Lynn. Let's see. I've had a strange thing happen that I'm hoping you might have some insight about. I have been having a high cytokine reaction that was causing body-wide pain, and it was improved some, but not completely, with curcumin and glutathione, as well as vitamin D, isoquercetin, Bpc157, SPM active, and low-dose naltrexone. Recently, I irritated an old knee injury slightly, and it got swollen and a bit stiff, and as soon as that happened, my body-wide pain went away. Is it possible that all the cytokines that were floating around my body and causing the pain all went to the knee where there was tissue irritation there? Do cytokines behave that way? I'm not aware that cytokines behave that way, and I'm glad that took all your pain away. I don't know why. I'm perplexed by that, so I'm afraid I'm not going to have a good answer for you there, unfortunately. All right. And I mean, the other thing is, I understand the timing of this hurting your knee and then pain going away suggests maybe that's the cause of it, but that's a time proximity, right? Hurt my knee, body weight pain goes away. But maybe that's just a coincidence. Maybe finally being on curcumin, glutathione, Bpc157, low-dose naltrexone, finally it all kicked in and your body-wide pain went away too. I mean, that's a possibility as well too. Okay. All right. Good luck to you. Thanks for your question. Hello, David. Let's see. You mentioned previously that for a very small percentage of individual, there's a genetic defect that prevents them from getting rid of mold toxins. Is there a genetic test that exists to confirm this defect? So yes, in fact, I just put out I put out a new article about the Shoemaker approach to mold toxicity, where I was critical of the Shoemaker approach. And also I re-updated my mold toxicity article. And in both of those, I talk about the test, but I can tell you what it is. So Dr. Richie Shoemaker is the person that discovered mold toxicity illness. And basically many of us don't follow his teachings anymore because they don't work that well for Lyme disease. But he is the one that founded it. And he was able to show that there are about 25% of people that have a genetic predisposition that sets them up so they could develop mold toxicity illness. All right. Now, I have found people have mold toxicity illness that don't have the genetic predisposition too. Okay. So the genetic predisposition basically explains why a large part of people get it, but it's not the only solution. So what happens with people with genetic predisposition is they have an abnormal genetic setup. And what happens in people that have normal genetic setup, so that I can explain what happens when you have an abnormal genetic setup, is what happens with normal genetic situation is you breathe in a mold toxin, it gets into your bloodstream, and your immune system will see it. Some blood cells come in and tag that mold toxin, and then other white blood cells come in and break the mold toxin down. Okay, that's what's supposed to happen. But if you have a genetic profile such that your immune system doesn't work correctly, it will not tag those mold toxins. Therefore, they don't get broken down. Okay. Now, the test that Shoemaker put out, and I think this is accurate. I mean, I agree that this is accurate determining if you have the genetic predisposition. Again, the issue is having a predisposition doesn't mean you manifest the problem, no, okay? But the genetic test is called an HLA-DR test, And Dr. Shoemaker and his website does a good job of explaining that test and how you interpret it after you get it done. So I'm going to do a screen share so you can figure out how to get to Dr. Shoemaker's site. Okay. So you go in terms, I'm going to do a screen share here. All right. So my latest 2 articles are my commentary on Shoemaker and why I think generally, other than his HLA-DR test, the rest of his testing is not accurate. And then here's where I talked about my perspective on how you test and treat mold toxicity illness, okay? But if you just go to this Shoemaker article, and then come down here, here is his website. It's called survivingmold.com. And on here, he should... I just seen where he describes it here. Diagnosis, symptoms, treatment. Here. This is his lab testing page. I just found it under the resources for physicians. Okay. And if you just start clicking through here, you'll find information about his, the HLA-DR test. Okay. All right. Actually here, lab test. Okay, yeah, here's his HLA-DR test, and down here is where he explains how you interpret the results that you get back from the lab, okay? All right. All right, good luck to you, David. Hello, Robert. Let's see. Hi, Dr. Ross. You are so appreciated. Well, thank you. Previously, you've discussed steroids and what to keep in mind for Lyme patients regarding injections, epidurals, and nerve blocks, as opposed to oral steroids like prednisone. The orals being of much greater concern with getting into the bloodstream. My lumbar with herniated disc has flared, and I discussed getting an epidural with my primary care, noting Lyme persister concerns. He said he could give me the steroid injections in my glute, and by going into muscle, there should be minimal steroids getting into the bloodstream. Oh boy, I disagree. I'll say more here in a minute. I've had 2 injections a week apart, which is helping my lumbar area. I have another scheduled. Thoughts. Do you think there is any significance between muscle and epidural injection? Thanks. Yes, I do. So there's the 2 strongest ways to get things into the blood are either, and this is with antibiotics or any medicines, is to inject it. Okay, and you can either actually inject it directly into the bloodstream, or inject it into the muscles and it's absorbed into the bloodstream. So I'm not sure what your doctor was talking about here. Doing a butt muscle injection sends it system-wide, actually. The way to keep it local would be your epidural steroid injection, where it's deposited right around the nerve, versus doing the butt muscle injections basically results in high blood levels. Okay. So for instance, let me do a comparison. One of the treatments that we can do for Lyme is we can do IV antibiotics. Many of us aren't doing it anymore. It used to be the big thing, but most doctors are pretty much relying on oral antibiotics these days. But one of the other things that we would do as an alternative to intravenous injections was intramuscular injections of a penicillin called bicillin. You could even do intramuscular injections of ceftriaxone, which is the main Rocephin ceftriaxone, which is the main IV antibiotic that people use. And doing it with butt muscle injections has equivalent chances of getting into your bloodstream and helping you as doing IV. All right. So I'm kind of concerned what your physician did there. And I hope you'll be okay. You probably are. I mean, just because there is the risk of steroids suppressing your immune system in Lyme and causing it to be more difficult to get under control. You've already done it. So, but I hope you do well. Okay. All Good luck to you, Robert. Hello, Colleen. After a lifetime of healthy teeth, my dentist suddenly tells me I have 5 cavities and should see an oral surgeon. Could this be related to Lyme? And are there things we do to keep our teeth strong when we have Lyme and co-infections? I've always had good oral health habits. Thank you for these webinars. I haven't seen this due to Lyme, to be honest with you. In my opinion, I don't think it is. I'm sorry to hear this has happened with you, but I treat a lot of people with Lyme, and I haven't seen people with Lyme have any greater predisposition to having dental problems than people who don't have Lyme. Okay? All right. Good luck to you, Colleen. Let's see here. Hello, Sai. Let's see. Have you seen difficulty in swallowing as a COVID symptom? I haven't. However, I could understand how you might be able to. Basically, COVID affects just about every organ in the body and can lead to neurologic dysfunction. It's possible you would have some neurologic dysfunction from COVID, resulting in difficulty swallowing. So it's possible. I haven't seen it happen, though. Okay. All right. Good luck to you, Sai. Hello, Denise. Let's see. Hi, Dr. Ross. I've been treating Lyme, co-infections, and Epstein-Barr for the past 8 months with herbals, some antibiotics, Plaquenil, the typical vitamin supplements, glutathione, curcumin, etc. I seem to have developed this summer, according to Google, what looks like vitiligo starting on the wrist and moving up the arms here and there to the chest area. Have you seen this connected to Lyme before? I thought maybe it was yeast, but there's no itching or scaliness, just loss of pigment. I haven't seen, so vitiligo means loss of pigmentation. Okay. There is one condition that can lead to skin coloration changes too, sometimes resulting in white patches, and that is a fungus infection called Tinea Versicolor. Versicolor means it shows up in many different colors, okay, but one of those can look like white patches. Usually those are small areas, though. You're describing something bigger. Before making a full diagnosis yourself, though, and I understand using Google, shoot, I try to teach people about all these illnesses too, but to make sure you're treating the right thing before you call it vitiligo, I would get your doctor to take a look at it, possibly a dermatologist, because there is this possibility if there are small lesions that maybe this is Tinea Versicolor, in which case you would want to kill the tinea, basically. You would want to get rid of the fungus infection that leads to the skin discoloration. Again, usually those are small spots, but anyhow, have somebody take a look at that, okay? All right. Good luck to you, Denise. Hello, Marg, or Marge. I'm not sure how that's said, but hi, Dr. Ross. Thanks very much for doing these webinars. You're welcome. Have you had any experience with treating Lyme patients with nitroxyline? I've read that it's successful completely ridding the body of Lyme germs. The answer is no, but I'm wondering, bear with me. I'm going to look this up. So I am not finding that drug in my drug directory, which which makes me wonder if you've got an incorrect spelling here. And I see you've sent me a few other messages as well, too. So I'm spelling nitroxoline, nitroxoline, and I don't see it unless you mean anyhow, I can't tell because I don't see it showing up anywhere. Okay. The other thing you may be looking at, bear with me, I always have to look this one up. So there is a drug called Alinia, and it is a generic for nitazoxanide. And I'm wondering if that is what you're talking about. Let me go back here. I'm wondering if that's what you're talking about. But I will tell you, I have used Alinia before, and just I don't find it to be that useful, to be quite honest. So I'm wondering if that is what you're talking about. I don't find it to be that useful. Okay. All right. But I can't tell what you're talking about from here. All right. Good luck to you. All right. Hello, Tim. Let's see. Hi, Dr. Ross. How are you this evening? I'm well, thank you. I hope you are too. I was wondering how to tell if a yeast infection such as Candida has become systemic, and would it be treated differently if it were systemic? I'm having great results with antifungal herbs, but was wondering if it will be enough. Thank you so much. All right. So I would say that 99.99999% of the time, people do not get systemic yeast. People that can get, by systemic yeast, I mean it got into your bloodstream and is living throughout your body. Okay. All right. The only people that might happen in are usually people that are severely immune compromised, like people with active HIV. And in fact, people with HIV used to get that in the days before we started having all the anti-HIV meds. All right. So in the early days of the HIV crisis. But most people, 99.999% of people, even people with Lyme, do not get systemic living throughout your body yeast. Okay. That's not to say that you don't have system-wide effects of Candida overgrowth in your intestines. So when you have yeast living in the intestines, your immune system, which is 60 to 70% of your body's immune cells lie in the intestinal tract, will react against that yeast and will make inflammation chemicals called cytokines. Those cytokines go throughout your body, giving you system-wide effects of the yeast that live in your intestines, basically. Okay. All right. So, the chances that you have body-wide yeast, if you did, you would be extremely ill, like on death's doorstep. I mean, people don't do this lightly if they get it. Okay. All right. And let's see. If it is systemic, people are on death's doorstep, and usually we're going to wind up having to do intravenous antifungals with them. One of those is a medicine called amphotericin B. We use that orally for intestinal yeast, and orally it stays in the intestines. It's not systemically absorbed. But when you take it in an IV form, it's very effective, but also extremely toxic to the organs in the body. Again, in an oral form, it's not toxic because it's not absorbed. Okay? All right. Good luck to you, Tim. I'm sure you all just heard all those sirens go by there. I am in a city. I'm in Seattle here, in one of the more dense areas of Seattle, actually. Hello, Brenda. Let's see. Hello, Dr. Ross. Thank you for these webinars. You're welcome. I have Lyme disease and Bartonella. I injured my rotator cuff doing simple yard chores. Is this problem common for Lyme patients? I have had problems with other joints, but not the shoulder. Are there any general recommendations? Thanks. So, one thing, and I don't think you're overstepping on this, but let me just make a comment. One thing we have to be careful about as physicians and as people living with Lyme is to not identify everything as being caused by Lyme. I call that putting your Lyme blinders on. So when things happen to people, it's not always due to Lyme. And what I would say is, in my experience, I haven't seen people have higher chances of getting rotator cuff injuries when they have Lyme or they don't have Lyme. So how I got into, I'm a family physician by training, and up until about 2004, my practice was a primary care practice. Okay, so I have extensive time spent managing the common problems that people come in with, and I can't say my patients with Lyme have any greater chance of rotator cuff than anyone else did when I was doing general primary care at one time. Okay. So therefore, I don't have any general recommendations. I mean, the thing that you would do is, this is something you should talk to your primary care doctor about. They may help you with some physical therapy, which is often one of the things that will be helpful for rotator cuff injuries, rotator cuff strains. The other thing is you want to be on anti-inflammatories like your curcumins that I mentioned earlier, for instance. Okay? All right. Good luck to you, brother. Oops. I'm sorry, Lynn. I meant to post your question. It looks like I got rid of it, and I don't have a way of pulling up ones that I got rid of. I apologize for that. Hello, Pat. What's the best way of testing for adrenal fatigue and possibly treating? After Lyme and co-infectious treatment, then a long period of unprecedented levels of stress, my body is feeling even more so like I was hit by a bus. Severe fatigue, weakness, irritability, exaggerated startle response, restlessness, food cravings, waking up feeling tired, unrefreshed, sensations like my gas tank suddenly ran out, and weight gain of 10 pounds. I want to check for adrenal fatigue. Thanks for all of your help, Dr. Ross. Okay. So let me just look. I want to look back through your symptoms here. Just bear with me a minute. Okay. So I'll talk about the adrenal fatigue, but I'm going to raise one other point with you. So when anyone has a sudden decline, even if you've got stress that might explain it, adrenal fatigue that could explain it, I always want to make sure that somebody hasn't developed intestinal yeast overgrowth. 80 to 90% of the time in my practice, when somebody had been doing better and then everything falls apart, it's too many yeast in the intestines. And the rationale, again, I mentioned yeast earlier tonight, is that those yeast in your intestines trigger excess cytokines to be made. They go throughout the body. And remember, all of your Lyme symptoms are really excess cytokine symptoms. So everything that you have as Lyme, like your body not doing well, weakness, irritability, all that stuff is due to excess cytokines. So if you get too many intestinal yeast, they're going to trigger excess cytokines, making it look like you're doing a lot worse with your Lyme or underlying infections, or maybe even that you have adrenal fatigue when you really don't. It's too many yeast. Okay, so things to consider that would suggest too many yeast are getting worse all of a sudden. Number two, increased sugar cravings, sometimes intestinal gasiness or bloating, increased food cravings. Sometimes that food cravings really are your yeast are asking for sugar. Okay. Doing worse if you have some simple sugar. So if you have that bag of potato chips, or you have some ice cream and you feel extremely bad, that can be a sign of intestinal yeast overgrowth. If you're a woman, having increased vaginal itching or vaginal discharge, and then the yeast manufacture toxins that are absorbed through your intestinal tract into the bloodstream. They go to your skin, and at the level of skin, they make it easier to get pimples or acne, or even have flare-ups in eczema, for instance. Okay, so if you have a lot of skin changes or acne, that can be a sign of yeast too. So kind of just go through those ideas that I just raised, or those symptoms, and see if you've got a number of those, and you might want to treat for intestinal yeast. Okay, all right. Intestinal yeast can look a lot like adrenal fatigue. All right. So if you want to then test for adrenal fatigue, one of the ways to do that is with saliva testing. Basically, you would take samples about 4 times in a 24-hour period, and then and your physician would help look at that with you, and then you would determine, do you have adrenal fatigue based on that? Okay, that's another way to wind up doing it as well too. Okay, all right, Pat. Good luck to you. Oh, let me do a screen share here for you. Okay, so in terms of how to diagnose yeast and how to treat it, this is my yeast section. You can find it by going to my online treatment guide, clicking on yeast right here, okay? And here's my article about how to diagnose yeast. And here's my article about what would you use to get rid of yeast, okay? All right. Good luck to you, Pat. Hello, Joyce. Hold on here just a minute. Hi, Dr. Ross. I've been taking Otoba bark and cat's claw for Lyme plus Tinea and Sida acuta for Bartonella. I recently questioned why, when I feel good and come off these herbs, I'm okay for 2 to 3 months, and then the floodgates open and I'm sick again. You suggested Crypto Plus, as there might be persisters. I started with 5 drops last Sunday. Number 1, do I continue with the other 4 herbs at the same time, which is what I'm doing? The first 4 days I felt was at my worst with symptoms that I hadn't felt in years. Is this normal? Number 2, a while back when you were out of Otoba and cat's claw, I purchased a different brand. The company advised that those herbs are more potent and I would only need 15 drops each. When I try to increase those to reach 30 drops, my body is writhing in pain. FYI, I also take glutathione, ATP360, and Cytokine. Any other suggestions? Thank you for providing this much needed help, as some of us can't find a decent LMD. The ones here in Arizona are selling $50,000 packages. Boy, that's crazy. Anyhow, all right, so let me make a few comments. So the Crypto Plus is a product by Researched Nutritionals that has in it cryptolepis and a number of other antimicrobial herbs. Okay, all right. What I had intended for you to get was cryptolepis just by itself, not with all those other herbs. So Montana Pharmacy, that I carry, that brand, has a pure cryptolepis. Now, you're not going to hurt yourself, but I just want to make that comment, okay? It sounds to, and yes, I would so your cat's claw, Otoba, Sida acuta, Tinea are generally treating growing forms of Lyme. That's your Otoba and cat's claw, and the Tinea Sida acuta is treating the growing state of Bartonella. The reason I suggested you add the crypto in is that when a person has relapses, you have to wonder, have they developed a reservoir of what we call persister growth state of Bartonella or Lyme, okay? And so that's the latest thinking that we have. We know from experiments about 6 years ago now that Lyme has the ability to have a growing phase, and about 10% of the germs might go into hibernation. We call those persisters, and they ignore standard antibiotics and herbal antibiotics, okay? And then we know from research about 2 or 3 years ago now that Bartonella has the same ability. About maybe 90% will be in a growing state and about 10% will be in a persister state. And so therefore, when you stop using your growing antibiotics, these persisters go back into a growth phase and you get symptomatic again, okay? So the crypto is a way of treating that, but you still want to treat both growing and persisting at the same time. Now, the crypto is interesting. If we look at experiments that were published by Johns Hopkins over this last year, cryptolepis, we know treats Babesia, the co-infection Babesia, okay? It's traditionally used as an anti-parasitic. Babesia is a blood parasite, so that's why we use it there, okay? But the experiments that got published by Hopkins show that it treats growing and persister Lyme, and that it actually treats growing and persister Bartonella. Now, I don't use it as a single agent to go after the growing, though. So we know you've had good luck getting better on your Otoba and Cat's Claw and your Houttenia and Sitta, so I would use them still. But I think you're missing a piece of the puzzle, which is your persisters, and that's why I suggested adding the cryptolepis in. Okay, so I would do them all right? And then I think those first 4 days you felt worse, probably some kind of a Herx reaction. Okay, that's what I think on that. All right, and then, this other company you're talking about probably is Nutramedix. And, everybody that their preparation is a little bit different, obviously, than the preparation that Montana Pharmacy does. As to whether it's always more potent, I don't find it that way. I sometimes find that patients have reactions on the Montana Pharmacy product even after they haven't had any on the Nutramedix products for a while. Okay, so I think it's very individual, actually. Let's see. Do I have any other suggestions for you? No, I don't. I would keep taking the glutathione and your curcumin, and then definitely work with the cryptolepis. The only suggestion I have is when you run out of the Crypto Plus, use a pure cryptolepis product, okay? And that would be the one by Montana Pharmacy, okay? All right, let me do a screen share here real quick. We'll look at something together here. All right, so in terms of what is in Crypto Plus, let's look at it. Okay, so the main thing, so cryptolepis is in it, but also lomatium and Asianthus, Julia nigra, and Stillingia. Okay, so you've got some other anti-parasitic herbs in here. The Lomodia actually is an herb that can help Bartonella, for instance. So this is a broad spectrum formula. I would probably just go to the Crypto by Montana Pharmacy once you run out of this. Okay, and so let me show you that one real quick. So the main line of herbal antibiotics that I like using is this one by Montana Pharmacy, which is right there. And their cryptolepis product is right here. Okay. All right. Good luck to you. Hello, Deborah. Is it safe, Dr. Ross, is it safe or smart to take enzymes such as natto and serrapeptase or Bolucki without an antimicrobial or antibiotic to kill the germs released? What if you do? I know I'll have a major hurt. My doc wants me to do this to do a new test. So, basically the enzymes like natto, serrapeptase, Bolucki is actually lumber kinase. What these enzymes do is two things. Number one, they can break down biofilm, slime layers that cover your germs, exposing them to both your antibiotics and your immune system. Okay. And also these enzymes can break down fibrin that forms what are known as fibrin nest that are basically woven together with both Bartonella and Babesia. And again, when you break down the fibrin in these fibrin nest, you wind up getting more exposure of the germs to antibiotics if they're on board and your immune system. And your immune system can be a germ killer. All right. So So is it safe to do? Yeah. I mean, your immune system should step up and do the job. Hopefully it'll do part of the job at least. Okay. All right. Good luck to you. Hello, Astrid. Hi, Dr. Ross. I have a horrible pain on my right rib cage, which has gotten worse over the last 2 days. I went to urgent care and they said it was my gallbladder. I will get a scan tomorrow to check and see if I have gallstones. I have been pulsing Doxy and Tetra for 9 weeks now. Could this also be inflammation and herxing? What do you recommend I do? The pain is horrific. Do a lot of other patients ultimately have to have their gallbladder removed? Thank you for everything you do. So I would need to ask you even more questions to help determine whether I think it's gallbladder. I can't tell from your description, but if you are having severe pain in that area, then I would agree. I think you need to be evaluated for gallbladder or gallstones. And ultrasound is the place you start. Sometimes that doesn't give us enough information. We have to do some special scans, like somebody called a HIDA scan, basically. All right. But yeah, I would. That's where I would start looking at it. And one thing that's interesting is that there's some evidence that one of the places Lyme likes to live in the body is your gallbladder. All right. So we probably do tend to see a little bit more gallbladder illness, gallbladder disease in people with Lyme than I would in a general family practice clinic like I used to have. Okay. All right. Do people ultimately have to have their gallbladder removed? If it truly is gallstone pain or gallstones and you are in that kind of pain, then yeah, I think you're going to probably need to be honest with you. Okay. All right. Good luck to you. Hello. Let's see. Hi, Emily. Let's see. What are some of the distinctive symptoms of multiple sclerosis versus tick-borne diseases? I'm afraid to get a spinal tap, but I'm not certain if there are any other testing procedures to tell the difference. Thank you. There is so much overlap between both of these. And keep in mind, Lyme can cause MS too, to be honest. It's not all MS is Lyme, but Lyme can be a cause of MS. That the only way to really figure out if there is MS is probably get a spinal tap and also do MRIs. Sometimes the pattern of lesions that are seen with Lyme are different than those that could be seen with MS. Okay. All right. So anyhow, good luck to you, Emily. Hello, Crystal. Let's see. Hi, Dr. Ross. There's a lot who disagree on this. Can Lyme be passed sexually? I know it can be passed to children. So the answer is we don't fully know. I think there's a possibility, but it's not clear that it actually is. And so let me describe that, okay? So we know that syphilis, which is a spirochete, like Lyme is a spirochete, is sexually transmitted. So on the one hand, we know spirochetes can be sexually transmitted, but Lyme's a different spirochete. So that doesn't prove it is sexually transmitted, okay? There's also been a couple experiments done that were pretty similar, and they, in one of those experiments, women living with Lyme and men living with Lyme, basically were studied to see what percent of the time could you find Lyme in their vaginal fluid in a female case or in the male ejaculate in a male, all right? The first study showed that it was in the male ejaculate 50% of the time, in the female vaginal fluid 100% of the time. And in the other study, it was reversed. It was 100% in the male ejaculate and 50% in the vaginal fluid, right? So we've got some studies that say, yeah, these things can be found in your body fluids. All right. Now, just because they're in your body fluids does not mean they have the ability to break through the barriers, the immune barriers, the immune defenses, the skin, and the white blood cells, etc., that are align the penis membranes and line the vaginal tract and actually cause an infection. Okay. So just because it's in the fluids doesn't mean it's going to be infected. Okay. Then there was a really poorly done study that was published about 10 years ago now that got a lot of notoriety. And if you research Lyme and sexual transmission, you'll find this article because it's one of the big ones out there. And this was a study that was published by Stricker, and I think Middleveen was part of that too. And based on their findings, Stricker was quoted, Dr. Ray Stricker is a physician down in San Francisco, used to be head of ILADS, was quoted as saying, we have more to fear in our backyards than we do, or more fear in our bedrooms than we do in nature in our backyards and getting Lyme. And I think that was a bit of a inflammatory overstatement. So let me talk about that study that he was part of, okay? So first of all, in the study, there were only 13 people studied. That's a huge problem. You can't make any generalities about the whole world based on a study involving 13 people, okay? It's just not big enough, okay? So that's problem number one. Problem number two, in their study, what they did is they looked at, they took the females and the males, and they were able to look at their vaginal fluid and the male ejaculate, respectively. And they were able to determine if there were strains of Lyme there, or if there was Lyme there, and specifically what strain it was, okay? And within these 13 people, there were 6 people that were that were coupled, okay? So male, female, male, female, male, female, all right? So in the male-female couples, each of them were found to have identical strains of Lyme in their vaginal and vaginal fluids and male ejaculate. And so the authors took that as saying, aha, if they have identical strains, that must mean it was sexually transmitted. All right. But here's the big problem. Other than there was only 13 people studied totally, the bigger problem is when you have it in the vaginal fluid, it could be there because your male partner ejaculated in you and left a deposit that's still floating around in there even days later, okay? They didn't control in the studies for male ejaculate. In other words, in the study, they didn't forbid male ejaculation into the female a week or 2 weeks before the study was done. So when they're measuring it in the male or in the vaginal fluid, it might be that it did not, that what's in there really is something that was left there by the male partner that may never even break through the vaginal barriers and get into the bloodstream. Or it didn't come from the female and leak into her vagina, okay? So it's a flawed study. It's a totally flawed study. So don't trust that one. All right, then if we look at experience of doctors that manage Lyme, many of us see families, sexual partners that both have it. And it seems to me that we see it a little bit more than you might expect based on rates in the general population. So maybe it is sexually transmitted, but I will tell you, it's the $1 million question. We don't know. We don't know for sure, unfortunately. Okay. And yes, I do agree. We do have fairly good evidence that shows that in utero during pregnancy, where you have mixing of the mom's blood with the baby's blood at the placenta, that you do get transmission there. Okay. That is, unless you're on antibiotics, in which case you don't get any transmission. So, but that's a slightly different situation. So just having it in the vaginal fluid does not mean it breaks through and gets into the bloodstream. Okay. All right. Good luck to you, Crystal. Hello, Crystal, again. Let's see. Those who react to curcumin, is there anything else that could replace it? Yeah. So again, the reason that we use curcumin is through a variety of mechanisms. It decreases white blood cells' ability to make cytokines. Okay. An alternative to that would be to use quercetin, and that's Quercetin. Quercetin is a bioflavonoid that we've historically used to actually stabilize mast cells and limit histamine release in allergies, and we use it as part of mast cell activation treatment. But it also is what is known as a kinase inhibitor, and the word cytokines, all right? So kinases are enzymes that are used to help produce cytokines, and if you block them with quercetin, you decrease cytokine production. I like using a 250 milligram pill for that by Thorne. It's their product called quercetin phytosome, and I'll have people take 2 pills or 500 milligrams total 3 times a day, okay? And in addition, you would want to be on glutathione. And glutathione can be helpful also, and I mentioned that earlier tonight. All right. Good luck to you, Crystal. And the glutathione, the product I like is liposomal glutathione by Researched Nutritionals. Their product is called Trifortify, and I would do a minimum of a teaspoonful of that product 1 time a day. Okay? All right. Good luck. Hello, Leanne. Let's see. I'm unable to get the cinnamon, clove, and oregano combination in New Zealand. What would be a suitable replacement for these? You could just try using oregano oil by itself. In fact, here, the main company that makes this liposomal cinnamon, clove, oregano oil combination is a company called Dr. Inspired Formulations. And before they ever started producing that product, they were making a liposomal oregano. And I used to have fairly good results with that alone. I find better results with the combination, but oregano oil is fairly easy to find out there. And I still use it. Like if I've got somebody that is really reacting with huge Herxheimer reactions on the cinnamon, clove, oregano oil combination, I will switch them over to just an oregano oil combination and build it up slowly, basically. So it can be effective. It can be effective. If you're going to do oil drops, I usually have people work up to 5 to 10 drops of oregano oil twice a day. Okay? All right. Good luck to you, Liam. Hello, Mosby. Which infection causes strange, not rashes, but strange indentations not caused by anything compressing it? I don't know. I would need to take a look at that. I'm not fully understanding what you're describing there. So I'm sorry. I'm not going to be able to answer that one for you, Mosby. Hello, Brenda. Let's see. Thank you for these webinars. Oh, we already answered this earlier. It's about your rotator cuff. Hello, Francis. Let's see. Thanks, Dr. Ross, for all you do. You're welcome. Let's see. I have a question for a fellow Lyme friend. She has developed an unusual taste problem. Everything tastes like rotten onions when she eats, and she's dropped a lot of weight. I heard this could be due to part of the brain that rules taste. What treatment can help? Wow. Clearly, it's a neurologic dysfunction of some kind, whether it's of the taste buds or at the brain level. It is neurologic. I haven't had this specific problem develop before, but I would think of doing nerve repair as well as supporting healthy nerve function. All right. So for that, I would consider doing glutathione. It's an antioxidant. I mentioned it tonight. It helps repair injury from the inside of nerves. Okay. And liposomal 5 milliliters once or twice a day. I would also consider using the peptide, which is called Bpc157. Peptides are strands of amino acids that are less than 50 long. If you get a strand of amino acid that's over 50 amino acids, we call that a protein, okay? And there are a variety of peptides that are made in organs in our body. There's one called Bpc157 that's made in the lining of the stomach. And it can balance the immune system, but also it can repair tissue damage and injury. So joint pain, muscle pain, ligaments, etc., but even neurologic injury as well too. And that there is an oral form of that made by a company called Integrated Peptides, and that would be a 1 pill twice a day. You might give that a try too. Okay, all right. Good luck. Good luck to your friend. Hello, Mary. Let's say hi, Dr. Ross. First, I want to thank you so much for giving me the advice about Candida last month. I do not think that it will be too easy to get rid of and overgrowth quickly. My herpes are very severe. I went to an allergist immunologist specialized in Candida. His plan before diflucan and nystatin is to do IV glutathione and vitamins and possibly a small amount of gamma for anti-inflammation to lessen the herpes before treating with diflucan and nystatin. He advised me to stop all antibiotics and an antimalarial pill now. What's your thoughts on this? I mean, the IV glutathione and the vitamins will help work to get your already overproduction of cytokines under control. Therefore, you might not have as much of a herpes reaction. That's what he's proposing. She's proposing is one way to do it. Okay. Another thought would be to just start with nystatin by itself, and instead of doing 2 pills twice a day, you might begin at 1 pill twice a day. Do a gentle removal of your yeast, and then as you can tolerate, add in the diflucan at half strength at 100 milligrams a day. And then after a week, if you can, go up to full strength, okay? So another way to approach this is just don't be so aggressive with your killers and step into it more gently. You could do it that way as well too, okay? All right. Good luck to you, Mary. Hello, Dawn. Let's see. I have Lyme and Bartonella. I have been on and for a year. Rica pain. So I'm not understanding a lot of what you're written here. So you're saying I have been on and for a year. Rica pin it bring in and Munich like plus 3 months of Ibuprofen. What are my symptoms? Permanent? I have a weak voice, not steady gait. It's hard for me to say. So one thing I will tell you is in Lyme disease, it can sometimes take 1 to 2 years to improve or get better or get well. And we know that based on a study that was done by LymeDisease.org and its project called My Lyme Data. All right. They had a study done about 2 years ago where they looked at people living with Lyme and that had lived with Lyme or living with Lyme, and they asked the group that had gotten well or 100% well or very well, and they asked them, what did it take? And they looked at, and basically the answers wound up being regular antibiotics over that time period and working with a Lyme literate medical doctor. So anyhow, there you go. Okay. Good luck to you. Hello, Leanne. Let's see. Thanks, Dr. Marty. How slow can I start a protocol using tinidazole 500 milligrams? Can I start with 1 pill a day for 4 days for the first few days and increase to 2 per day? So the answer is yeah. I mean, you could even start at 250 milligrams one time a day if you're concerned of a big herx, and then build up from there. So yeah, you could do something like that. Okay, everyone, tinidazole is in a family called the azoles. It tends to be one of our stronger anti-cyst agents, and also has got some laboratory evidence that can break apart biofilm as well too. All right. So yeah, anyhow, good luck to you, Dan. Hello, Frank. Let's see. Dr. Ross, my wife is currently taking your herbal protocol for BART. She experiences intermittent severe constipation and gastroparesis. These symptoms were also happening before she began the treatment. When these flare up, how would you treat them? The gastroparesis makes it hard to give her fiber supplements consistently. Thanks. So I'm sorry to hear this, Frank. It's a difficult situation. So one of the things that can happen with both Lyme and Bartonella is that they both can cause nerve inflammation or nerve injury, and especially the nerves that make the intestinal tract work. Okay, so if her and you need healthy functioning nerve signaling of the intestines to cause the muscles that line the intestines to contract to squeeze your poop through, basically. All right. So it's possible. Again, I don't get to ask her 1,000 questions to figure this out, but for what you've briefly written here, it is possible that she's having constipation and gastroparesis due to neurologic dysfunction related to Bartonella and or to Lyme. Okay. All right. So ultimately helping will be to get those infections under control. Other things that could help the gastroparesis due to neurologic dysfunction would be to be on a good antioxidant, the glutathione that I mentioned earlier, which is a restorative, reparative antioxidant that gets inside of cells and fixes injury. And that would be to take 5 milliliters of the Trifortify product one time a day. The other thing you might want to consider, and I haven't done this yet, but knowing what it's supposed to do could be helpful, would be also to help start doing neurologic repair is to add in that Bpc157 peptide I mentioned earlier tonight to repair the nerve injury, to repair the gut lining. And that would be 1 pill twice a day on that. Okay, so that's going to help get some improvements. But more acutely, because I know what you're really asking is what do we do to get her to poop when she's blocked up like this? If she can't do fiber, the other things that can sometimes be helpful is magnesium and vitamin C. Both cause more water to be retained in the intestines, making things looser to go through. Okay. A magnesium dose, you could do like a magnesium citrate, 400 to 600 milligrams at night. If that's not enough, you could do 400 to 600 milligrams in the morning. Magnesium, the limiting dose is basically, those would probably be your limiting dose. If you start getting much more above that, you definitely will get diarrhea. If that doesn't work well enough, you could add to it buffered vitamin C, and you could do anywhere from like 3,000 milligrams up to 10,000 milligrams as well too. Okay. And you could do that along with the magnesium at the same time. Good luck to your wife, Frank. And thanks for the question. Hello, Jules. Let's see. Hi, Dr. Ross. I've been taking CSA tincture for Babesia. I've worked my way up to taking 1/3 of a teaspoon 2 times a day. I'm starting to get pain under my ribs on my right side and sometimes my left side. My kidneys also seem to hurt a bit. Is this from die-off, or have you seen people react this way to the tincture itself? I haven't seen people react this way to the tincture itself, although that doesn't mean it's not your reaction to the tincture. And it is possible it could be herx. I would definitely make sure when you're having these kind of pains, though, that you talk with your physician or whoever's managing your care, and they probably should examine you to make sure, is this kidney, is it gallbladder, or is it related to killing of germs? Okay? All right. Good luck to you, Jules. Let's see here. Hello, Catherine. I was diagnosed with BB, which I think you mean is Borrelia burgdorferi or Lyme, okay, and RF, which I think you mean is relapsing fever, which is also caused by a Borrelia type spirochete as well too. About 3 years ago, chronic, as I never had a rash, fever, or other symptoms that pointed to Lyme. I did a detox then, herbal protocols, and my doctor recently ordered another IGeneX test for me, and this time Bartonella showed up along with the others I mentioned. Does it make sense to do an antibiotic protocol, which I have never done for Lyme, as it is chronic? My worst symptom is peripheral neuropathy and weak legs going uphill, which may not even be related to the Lyme. I'm so grateful for your informative website and webinars. You are a lifesaver for many of us dealing with Lyme. Thanks, Catherine. So, whenever you make a decision to use either prescription or herbal antibiotics, it's a risk-benefit consideration, okay? So the risk is not getting rid of symptoms that may be hurting you, okay? Now, if the symptoms you're having seem to be fairly tolerable to you, then you may decide that it's not worth doing the risk of antibiotics, okay? So what are the risks of antibiotics, either herbal or prescription? Well, both of them can lead to changes in your gut microbiome. Okay, that's your risk. That's your big risk. Also, any one of these has particular side effects. Some antibiotics, for instance, give you liver inflammation. Okay, but your long-term concern is doing some disruption of the gut microbiome. And I will tell you, we are only scratching the surface of the importance of the gut microbiome. But think of the gut microbiome as its own organ. Okay, it is heavily involved in detoxing. It removes things we're allergic to. It makes neurotransmitters that help our brain work well. It helps with food digestion. It makes chemicals that tell your immune system to work correctly, all right? It's an important organ. And to put it in context, if we look at all of the genetic material in our body, 90% of the genetic material that we carry around in our body, including our own cells, is from all the microbes that live in our intestinal tract, 90%. So there's a lot of stuff living there. And we're not just letting it live there because we want to give a free ride. We're getting something from it, okay? And so what we're getting is it has its own function. I mean, as I said, detox, immune function, et cetera, et cetera. So, it's a consideration you need to think about is, do you want to risk disrupting your good microbiome for the type of symptoms you're having? And only you can make that decision, all right? Now, I will tell you, we have no data that says if you don't treat the Lyme, is it going to progress down the road? It may or may not. We don't have any data that says it does or does not, okay? All right. So good luck to you, Catherine. And thanks for that question. Hello, Laura. Say hi, Dr. Ross. What is your recommendation for a high-quality fish oil or fish oil krill oil combination? Thank you. What I use in my practice, I've been using a Researched Nutritionals product. Let's look at what it is here together. I think it's called Omega Plus. Omega-3 plus. All right, so this would be your, all right, so this is a natural fish oil concentrate. So anyhow, this is the product that I've been using, okay? All right. All right. Good luck to you, Laura. Hello, Christine. Let's see, I'm being treated for Bartonella and Lyme. I have had Lyme before and so have a lot of old antibodies for Lyme, but I have never had Bartonella before. Am I having to sleep a lot because my body is trying to figure out how to make a Bartonella antibodies? My Hygienics saw no antibodies but could see the Bartonella on the fish. I have about 10 antibodies to Lyme from the past. How can one encourage making Bartonella antibodies? How long does it take? Thank you. Test. Okay. So Bartonella, the testing that Hygienics does, and I think they're the only one doing the Bartonella fish. So so testing for Bartonella, there's antibody testing we can do, and then there's also this test called a fish test. Fish test means that we use a fluorescent agent that attaches the genetic material of Bartonella, and that makes it so that we can see it under the microscope, okay? The marker that is used to attaches to the family of Bartonella, so it's not germ specific. In other words, it's not Bartonella henselae specific or Bartonella vinsoni specific, but rather the whole Bartonella family, okay? Right. Versus antibody testing, depending on where you had it done, may only be sensitive for certain strains, okay? So, for instance, if you go through a regular lab, you're going to get a Bartonella henselae. You might get a Bartonella quintana test, but that doesn't test for the remaining 13 kinds of Bartonella you can have that the fish test would be able to detect, okay? On the other hand, if your Bartonella testing was done through Hygienics, beyond the fish test, and you had the Bartonella immunoblot through Hygienics, their immunoblot, which is an antibody test, looks to see, do you have antibodies against one of 4 strains of Bartonella, and in addition against the whole family, including the 15, which includes all 15 strains, okay? So on that test, for instance, if your family test comes back positive, but you're negative on one of the 4 specific strains, it means you got one of the other 11, okay? All right. So anyhow, all right. So the key thing is, to answer your question, is if your Hygienics or if your Bartonella testing was done at another lab, it was limited. It wouldn't have looked for all the strains, basically. If it was done through Hygienics, their antibody test, the immunoblot, is able to find Lyme when it's present, or Bartonella when it's present, about 90% of the time, but it will miss it about 10% of the time. So it's not a perfect test, okay? If you have active Bartonella, sometimes due to immune suppression from Bartonella, your body will not make the antibodies. The way to deal with that is kill enough Bartonella that your immune system will stop being suppressed, so it will start making antibodies, okay? Unfortunately, those are the options we have, okay? All right. Good luck to you, Christine. All right, everyone, that's it. We've been at this for about an hour and a half tonight. I've enjoyed myself. I hope you all did too, and that you got some useful information out of this. Next week, as I mentioned earlier tonight, we will be with you on Wednesday. Okay, we're going to do a Wednesday webinar. It will be at 4 p.m. If you previously had signed up for the Thursday webinar, you got to sign up again. Sorry about that, but I got an obligation next Thursday, so I will not be able to make the webinar next Thursday, so I moved it to Wednesday. Okay, so we'll be getting together for the webinar next Wednesday at 4 p.m. Seattle time, which is Pacific Standard Time. All right. Keep your eyes out on your email tomorrow morning. You will get an email from me that will have a synopsis of what we talked about tonight, and will indicate to you that the video has been edited and is published and ready for you to take a look at. Okay. All right. So in that email, you'll also be able to sign up for the next webinar. So I look forward to seeing you then too. All right. Good night, everyone. Been good being here with you here tonight, and have a good week.